Our Nine Health expert, Dr. Payal Kohli, joining us now to give just more context about Omicron. So why is this variant getting so much attention, and what should we be the most worried about?
Yeah, we've had so many. So why are we paying so much attention to this one? It's because of the sheer number of mutations that it has. So it has over 30 mutations just in the spike protein, which is the doorway that it uses to get inside our cells. And some of these mutations we've never seen before, so we don't even know what they do. I don't think it's time to panic yet. We're still very optimistic that the vaccines will work, but we really need to keep our guard up when it comes to this variant.
Yeah, it's been, and also I think the timing, coming around Thanksgiving and everybody planning to travel, I think everybody's like, woo, we got to pay attention.
It's going to hit us like a ton of bricks, because if there's already a case here, which many health experts think here in the United States there's one, maybe even here in Colorado, it's just a matter of time before it takes off, especially if it's more transmissible than Delta, which is what that preliminary data from the World Health Organization is telling us, that it is more contagious than Delta, which was already several-fold more contagious than the original variant.
I remember when Delta came around, there were different symptoms, because we were like, which one do we have? Is this the original? Is this Delta? Are symptoms different with Omicron?
We're getting some preliminary information there. So this is all anecdotal, and we don't have a ton of cases, but what it looks like based on South African doctors' descriptions is that the symptoms appear to be mild to moderate. So that's good news. People are not necessarily ending up in the hospital if they're vaccinated. We're also not seeing any reported cases of loss of taste or smell occurring with this variant. Yeah. And we're seeing a really profound fatigue, even more pronounced than the previous variant. So again, this will play itself out as we start to have more cases, but at least preliminarily, it looks like it may have a different pattern of symptoms.
So we're still waiting to find out all the symptoms, and then also waiting to find out if the vaccines have any protection against it.
That is the biggest worry, that this is a vaccine escape variant, that the vaccines don't work at all. Realistically, I really don't think that's going to be the case. I think there will be some degree of cross protection, but again, time will tell. So what they're going to do now is take the serum of vaccinated people, mix it with the variant, and really do studies to try to understand how well it protects. But every time you get a vaccine, it's like flexing your immune system's muscle. You make it a little bit stronger. So even if you get that booster against that original variant, you are going to offer yourself some protection against Omicron.
So that essentially is how we keep ourselves safe. Even with a vaccine, we don't know how, it's going to react to this new variant.
You got it. So if you're not vaccinated, you need to get vaccinated. If you're not boosted, go ahead and flex that immune system's muscle, get boosted. Keep wearing those masks, because it still spreads in the exact same fashion as the other variant, is through respiratory droplets, person-to-person contact. So keep doing all of those things, because we really need to buy ourselves time to get more information before this gets ahead of us.
So that's kind of your message to those that are still resistant to do this. Just go ahead, do it, because we're going to continue to see these. I mean, we're just going through the alphabet at this point.
We are. Right? We're almost near the bottom, and I never knew I would learn this much about the Greek alphabet, but I really don't let this be an excuse to not get vaccinated. In fact, the opposite. If you want to stop these variants from emerging, embrace those vaccines so we can get our lives back to normal. We can start getting rid of these variants and start living alongside this virus instead of letting it control us.
Yeah.
Well said.
All right. Thank you, Dr. Kohli, as always.